So as we enter this area and the new era of the 2020, let's think about how we can use data to improve adolescent health in your state. How can we be sure that when we reach the year 2020, we've made a lot more advancement than we've been able to show for 2010? Next, a new resource that will be hopefully helpful to many communities and many of you is the NAHIC, the National Adolescent Health Information and Innovation Center data project to improve adolescent and young adult health, the national and state profiles. So we've been able to compile available data and make that data much more readily available. This data allows you to see what kinds of disparities exist across gender, race, and ethnicity within your own state. And to also have this in a user-friendly format, so some of you who are listening to this webinar may not feel as comfortable with data as well as others who do have a lot of experience. Let me reassure you that this resource has been built with you in mind. And also it allows you to explore the tremendous variability across states without needing to spend hours finding, downloading, and cleaning the data yourself. And it enables states to easily compare their own progress within themselves, so looking at historical trends, as well as with other states. And it gives you an opportunity to really begin to explore not only negative progress, but also I think it's very important to call out what I consider or call positive deviance. That is, areas where we really have made significant positive progress for young people, and we need to learn from those lessons as much as we need to learn from those areas perhaps where we haven't done quite as well. Next. So if you go to this data set, what are some of the ways, for example, if you're running a community clinic or if you're running an after-school program or you're the staff member of a state legislator or your school superintendent, how can we be thinking about your use of this data source? First, I think it is important to look at your own data as compared to national rates. Maybe the adolescents in your state are not exercising as much, or perhaps they're fighting more than the national picture overall. Or perhaps you'll find that some of the data points out to an unhealthy change that runs counter to an improvement that has been documented nationally. So, for example, in your state, there may be an increase in tobacco use as compared to the national decrease overall. And it's important to be also reviewing your state in terms of whether there are large disparities. Is there a threefold gender difference in one state compared to a much smaller difference among gender groups nationally? So as you review your own state data, this exercise of looking at perhaps these 21 critical health objectives helps you to consider what are going to be the areas for priority. Perhaps these are some of the areas you've worked on already, but these are areas that still need more progress. Or perhaps you see that you want to work on a new focus area because of what the data points out to you. So let's go on to the next slide. And we really want to encourage you to be thinking not only about making these comparisons with perhaps similar states or states in a specific region, but to also be thinking about what's different about the types of policies or programs that have been implemented in those states that you are comparing yourself to, what other communities and states are doing to achieve success on some of these individual objectives, and to also use this as a motivator to begin to identify and study other evidence-based approaches and to consider how to begin to incorporate some of those within your own community, region, or state. And then ultimately to determine the strategies and to take some action. So, next slide. One other tool that you might find helpful was a guidebook that was developed for the 2010, but it was written in such a way that it continues to have relevance for 2020. And within this guide for state and local agencies and organizations, there are materials here in this guide that will help you around building community coalitions, or how to conduct a needs and assets assessment, how to help with this very important priority setting, as well as program planning, implementation, and evaluation. And this really aims to build on an overall national effort to improve adolescent and young adult health. The next slide shows contact information for our center. And my final slide, next, is a picture of the Golden Gate Bridge. I'm using this bridge as a symbol of the kind of experiences that we've had in 2010 as we move into 2020, and really a symbol of the importance of bringing together multiple sectors to really engage in and be committed and dedicated to improving the health and well-being of our future, our nation's future. Thank you very much.